Welcome to Medical Minutes here on Time Warner Cable DMG TV2. Today we take a trip to Trinity Hospital Twin City, where respiratory therapist Joni Baumberger walks us through cardiac rehabilitation. Also, another respiratory therapist, Erica Gallagher, explains all the diagnostic tests involved with heart-related issues. Then we come back here to the studio where we visit with Dr. Bill Pipoli. He is with Mercy Cardiovascular Institute, and he gives us the ins and outs of heart attacks, all coming up on Medical Minutes.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, Newcomerstown, and Millersburg. Let's get started building our relationship.
A nursing home or your own home? It's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
At Trinity Hospital Twin City, we have a full-time non-invasive cardiologist and experienced cardiopulmonary technologists who can help you obtain your diagnostic tests and results quickly. We also have many heart care services to help you achieve optimum heart health. Let your primary care provider know you'd like to choose Trinity Hospital Twin City for your heart care. Call 740-922-7480 to schedule an appointment with our cardiologist or visit trinitytwincity.org for more information. Welcome to Time Warner Cable TV2's Medical Minutes. I'm Jennifer Clark, and today we're on location at Trinity Hospital Twin City. We are in the Cardiac Pulmonary Rehab Unit, and we are with Joni Baumberger. She is a registered respiratory therapist. Welcome.
Thank you, and welcome here as well. We appreciate you coming.
Tell us a little bit about the Cardiac Pulmonary Rehabilitation Unit. What do you do here?
Okay, basically what we are trying to do is folks that's had recent heart attacks, have like your heart diseases, coronary artery disease, things like that. We want to build them up and get them back to their regular type of living again, just day-to-day activities that they usually did before this heart attack.
And what can you do for them? They get on these treadmills and exercise bikes?
Yes. What we do is custom design an exercise program for each individual. We also keep track of their blood pressure, their heart rates. We even build up an exercise program that they can follow at their own pace. So they work out about 45 minutes to close to an hour a day. And again, with keeping a thorough watch on their blood pressure, their heart rhythms and rates and what's going on, we just want to build up that heart muscle once again for them so they can get back to their daily living.
Now, there's a lot of equipment in here, and it's all different.
Yes, each one, though, again, is targeting your heart area and also pulmonary as well. We just want to strengthen up the muscles and also give them reassurance that it's okay to exercise after having a heart attack.
I imagine they're a little anxious.
Very anxious, yes. They're always kind of worried about a reoccurrence of a heart attack again. And I think with being having on the monitor and everything as they're working out, that kind of relieves that fear that it could happen again.
And how long does that normally take to get everything back to where you were before the heart attack?
Well, we like for them to come at least 36 visits. And again, that's 3 times a week, 45 minutes a session. And you can tell, and when they first start working out, it's pretty low. And, and I'll tell them, slow that Mustang down, keep it low, easy. And they adhere to that. And then pretty soon, in a couple weeks, they're increasing what we call their METs, their workout, the length of activity that they're doing. And by the end of the 36 weeks, they're very impressed with themselves. They're very encouraged that they can go 45 minutes, where before maybe they never worked out that long.
Did they work out before the heart attack?
I would say about 80% no. No, that this is something new to them, because you can see they get the deer in the headlight look when they come in, and just not quite sure this is for them. Because some will say, I hate exercise. I never exercise. But once they get in the program and they're working out with maybe 3 other people in the program on their time, they start to enjoy it. And we have a maintenance program after, when they complete it, that they can come back in and work out for $25 a month. And you can't touch some gyms for that amount.
And how do they get here in the first place? A doctor has to prescribe it, right?
That's correct. It has to be a doctor's prescription, and usually it will be their cardiologist or their primary care physician.
And when their doctor says, you're going to have to go to cardiac rehab, are they a little nervous about that? That they said, oh, I've never worked out before,
Yes, definitely. We do get a lot of that. But again, everything is custom designed to each individual. No one starts off on the same level. It's what they can handle and have no pain. And, their breathing, we check everything to make sure they're getting along at that very first get-go of the program. But once they get started, you'll be looking over to them from the monitor and you're saying, hey, you're speeding up here. And, well, yeah, they don't, they realize then that they are accomplishing, and they can go ahead and work a little harder without that fear.
And do you report back to their doctor?
Absolutely. Every 12 sessions that they are here, we run a report of their heart rhythms and rates, and it's reported right back to their cardiologist or their primary care physician.
And do any of your patients have a heart attack again?
It has happened, but I would say percentage very low.
And that's because you're exercising their muscle.
You're working that heart muscle, yes. And your heart loves exercise. We have people that come in with maybe walking in 80 beats per minute. And when they're done with their exercise session, at that session, it can drop down 10 beats, and I'll tell them, hey, your heart loved this exercise. You've dropped 10 working beats off of your heart.
And are there different goals for different patients, I imagine?
Absolutely. Everybody's different. So we custom design each individual.
What are some of the different goals that you tell them that they're looking for?
I get a lot of folks that say they cannot walk the mall with their wives, or just simple things that we take for granted. And they'll often come back and they'll say, you know what, I'm walking 2 miles now on my own. I can go to the mall and walk the complete mall with my wife. So yeah, there's a lot of great benefits to it.
And besides your monitors of their heartbeat, and do you look for shortness of breath and other things too?
Yes. We're watching their breathing patterns, seeing if they are breathing pretty strongly. We look if they're sweating. There's all different signs you're always constantly watching besides the rhythms, yes.
And what do your patients tell you once they're all done with rehab?
They're excited. They get a diploma and a T-shirt, and they enjoy that, and they're very happy. And a lot of them, like I said, will go to maintenance, and a lot of them they exercise. They keep an exercise routine at home.
And that was my other question. How long does that last for them?
Usually, what we tell them, you got the foundation built, keep the house on top.
Fantastic. Joni Baumberger, she is a registered respiratory therapist here at Trinity Hospital Twin Cities Cardiac Pulmonary Rehab Unit. And for Time Warner Cable Medical Minutes TV2, I'm Jennifer Clark.
Are you suffering from asthma or emphysema? Do you have shortness of breath or a nagging cough you just can't shake? Hi, this is Dr. Nathan Samsa. I'm originally from Strasburg, and I've returned after my medical training to serve the Tuscarawas Valley. I'm board certified in pulmonary medicine, and I'm ready to treat your breathing and lung problems. My office is located at Union Internal Medicine Specialties, 515 Union Avenue, Suite 187 in Dover, Ohio. Call me at 330-343-4411 for a timely consultation.
We live in a fast-paced world. Say goodbye to searching books and search engines for all the answers. Now there's iTowns. From finding a place to dine or locating your family doctor, you can also check out the high school game of the week from TV2 Sports. Get your answer with just one click. iTowns has it all.
Welcome back to Time Warner Cable TV2's Medical Minutes. I'm Jennifer Clark, and once again, we are on location at Trinity Hospital, Twin City. We're in the Cardiac Pulmonary Rehab Unit, and with us this time around is Erica Gallagher. She is a certified respiratory therapist. And what do you do all day?
I do all kinds of stuff. We do a lot of diagnostic testing here at Twin City Hospital. We also do a lot of preventative testing.
And when you do the preventive testing, that's kind of diagnostic testing where you try and figure out what's wrong and what's going on.
Correct, yes.
And there's a long list of these tests. What's the most frequent that you do?
It's an electrocardiogram, which is also known as an EKG. And what that does is it gives us a nice little printout of the electrical activity of your heart, a rhythm and a rate, on just a nice little sheet of paper that we send to the doctor, and it's read.
And what are you looking for on that sheet of paper?
We're looking for if they have any kind of arrhythmias, if the heart rate is too fast, too slow. It can even tell us if they're having an active heart attack.
And then another test is called an echocardiogram. What's the difference between the EKG and the echocardiogram?
The echocardiogram is a little bit more extensive. What it is an ultrasound of a heart, just kind of like they do on babies, except it's on your heart. What that's going to do is show all the valves, the blood flow, just about everything.
And what are you looking for there as far as irregularities?
If they have a heart murmur, if they have any kind of vegetation, fluid on the heart, it shows a lot of abnormalities.
And another test, ABI, what's that?
That is an ankle brachial index test. And
what does that mean?
What that does is we take blood pressures on their arms and ankles, actually, to check for blockages there.
So getting your blood pressure on your ankle sounds very different. What does that show you opposed to your arm?
It just shows if you have a blockage in one of your arteries. You have arteries all through your body. So on your ankle, there is one down there, and they just take a Doppler, which is...
It sounds like something you do for weather.
Yeah. It's a sound wave, and we listen to it and take the blood pressure and just listen for the pressure.
All right. What are some other tests that you get to do?
We have a sleep lab here. I don't personally do it, but it is a very good test. Sleep lab is very important for your heart as well. It sounds like more of a respiratory issue, but if you're short of breath at night, your heart is working harder. So that's a good one. Tilt table testing, which we are one of the only ones around here that do so. We get a lot of patients for that. That is checking to see if somebody has passed out and they don't know why. That could be a blood pressure issue, multiple things with that, maybe even a carotid artery blockage. Dr. John, our cardiologist, sits in on all of those. We do.
What's involved with that tilt table? You have to start out laying down and you move them around?
Correct. We have them laying flat at first. We'll do an EKG, and then we tilt them up to 70 degrees. Every 5 minutes for 30 minutes, we take a blood pressure and a rhythm strip, and we just correlate it and just see if it's dropping or picking up. And after that, Dr. John will press on the sides of the patient's neck, and what that's doing is checking for a carotid artery blockage. And then after that, we set them flat, do another EKG, as long as they didn't pass out before that is, and they're done.
That's relatively new as well, right?
We've been doing them for about a year now. Yep.
And then there's other tests that you do as well. The stress test is something that a lot of people may be familiar with, where you're on a treadmill and you're monitoring them with a stress test. But you don't always have to be in motion, right?
Correct. We have a pharmacological stress test. We inject a Lexiscan, that's the medicine we use. What that's doing is your heart rate will go up without exercising.
Isn't that dangerous?
No. Myself, a nuclear tech, and Dr. John actually sits in on all of those tests. We do about a dozen to maybe even 20 a week, so it's a pretty common test.
And what are you looking for there? You're waiting for the heart to fail?
We are checking. What happens first is we take pictures of the heart at rest, and then we do it afterwards, and we can see if there are any blockages while your heart is being stressed.
And that's normally what triggers a heart attack anyway.
It can be.
And then just regular blood pressure testing. I mean, you just put a cuff on and see what their blood pressure is?
Correct. We have an ambulatory blood pressure monitor as well. What we do there is we send a patient home with a blood pressure cuff. That sometimes we do just because if they come in, sometimes patients have white coat syndrome. They see the doctor, their blood pressure skyrockets.
Because the doctor's wearing a white coat.
Correct. So we send them home with a blood pressure monitor. That way we can just see, well, maybe they were just nervous about their hospital visit.
Now, anything coming down in the future that maybe would also help in the diagnostic testing that we may not have here yet?
Not off the top of my head that I can think of. The ABIs we just started in the past month. We also do 24 to 48 hour heart monitors we can send home with people.
So you're telling me that this is best available technology?
It really is. It really is. I love it here. We do a lot of stuff. We stay busy, and the patients love it.
That's the next question about patients. How do they feel about doing all these tests?
It's very convenient for them. They can come in on a day that they're scheduled, and we can normally do, 5-6 tests in one day, get it all taken care of. So it's nice. It's convenient. The doctor is right here with us the entire time. It's very safe.
And the patients enjoy doing this, or they just want to get through it?
It just depends on the patient. Some of them actually do enjoy it. A lot of times, they come in kind of nervous, but we're able to calm their fears pretty easily.
And all of this, as we mentioned, are diagnostic tests. So they look at what's wrong with you and try and prevent some kind of event.
Correct.
All right, very good. Erica Gallagher, she is a certified respiratory therapist here at Trinity Hospital Twin City. We're in the cardiac pulmonary rehab unit, and we will bring you more medical minutes here on Time Warner Cable TV2 coming up. At Trinity Hospital Twin City, we have a full-time non-invasive cardiologist and experienced cardiopulmonary technologists who can help you obtain your diagnostic tests and results quickly. We also have many heart care services to help you achieve optimum heart health. Let your primary care provider know you'd like to choose Trinity Hospital Twin City for your heart care. Call 740-922-7480 to schedule an appointment with our cardiologist or visit trinitytwincity.org for more information.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. I'm Jennifer Clark, and in the studio this time with us is Dr. Bill Pipoli. He is a cardiologist with the Mercy Cardiovascular Institute here in New Philadelphia. You have an office, and also in Canton?
And at Mercy Medical Center, yes.
And as a cardiologist, what do you do? It sounds like a heart doctor.
That's what a cardiologist is, and I'm a specialist. That's all I do is cardiology. I do most areas of cardiology, invasive and non-invasive. Electrophysiologists do mainly rhythm disturbances, sudden death, defibrillators, ablations, etc. That's all they do. That's not what I am. But otherwise, general cardiology, including invasive.
So if I'm having a heart attack, they call you?
They would call me or one of my partners, Dr. Sabe in particular, who is a fantastic interventional cardiologist as opposed to myself being invasive but not interventional.
Now when I think invasive, I think, heart surgeon.
Invasive means basically invasive procedures. Heart caths. Interventional means stents, the different devices to open an artery, for example, a balloon valvuloplasty, etc. These kinds of things.
Wow, there's a lot of things you can do.
Lots of things you can do, Jen.
The first thing that we need to do as patients is prevent that heart attack, right?
That would be ideal.
What are some of the things, you think, well, I should quit smoking and improve my diet, right?
Those are good starts. The standard risk factors, you hit the big one, smoking, is that and an elevated LDL, the lousy cholesterol, L for lousy, diabetes, hypertension, obesity, sedentary lifestyle.
Easy to say, hard to do.
Very hard to do.
How do you get your patients to change their lifestyles?
Once they start to have symptoms or have an event, usually that's the alarm clock that they needed to go off.
And if I do have a heart attack, what can you do about it? Do you survive a heart attack?
Heart attacks, myocardial infarcts, MIs for short, is a huge health hazard. There will be 1 million heart attacks in this country this year. And unfortunately, although the statistics can't be exactly perfect, if you look at that million, about 300,000 will never get out of their home because they will have electrical accidents. That's the main cause of death in an MI, is ventricular fibrillation. And it unfortunately is something that is so readily fixed, so easy if somebody was just on a monitor. So if there's any one take-home message that I would think would be above anything else, is that if you're at home and you're having symptoms and you have a reason to potentially have coronary disease, don't stay at home. Get to an ER, call 911, get on a monitor.
What are some of those symptoms?
Classic anginal discomfort, angina pain, meaning heart pain due to a blockage, is described as a tight, squeezing, fullness, choking, heavy elephant on the chest type description. The problem is that you only get that description about half the time, which means half the time you have very atypical complaints, and particularly in females, they can have very atypical complaints. So you have to be suspicious. Other concerning symptoms that you see commonly would be arms that are heavy with exertion, air hunger with exertion that seems beyond the workload that you're performing at the time.
Air hunger, can't breathe.
Right, can't breathe. Marked dyspnea, shortness of breath, jaw discomfort, these kinds of things. Sometimes it can be between the scapulas.
That you're just thinking, oh, this is kind of a pain, but I got to keep going. I have too much to do today.
Right, yes. Unfortunately, a lot of people make that mistake.
And then what can you do if they have a heart attack? You mentioned some of the, after you've had a heart attack, you can open up clogged arteries, you can do things like that.
Mercy Medical Center in our practice is an emergency chest pain center. And what happens is if somebody comes to Mercy with a heart attack, an acute MI, they call a cardiac care. Mercy, I believe there's only one other hospital in the state that has an actual cardiac catheterization lab in the ER. Mercy is the other one. And that patient would be taken straight into the cath lab in the ER. A quick diagnostic heart cath would be done, and assuming that it was amenable, we would open that vessel with an angioplasty and a stent or whatever device was needed to get that vessel open.
And when you're talking catheterization, that's kind of a wire going through your arteries.
A cardiac cath is, yes, a cardiac cath is typically done through the right femoral artery in the right groin. We can also go through the left radial artery in the wrist. And a poke is made with a needle. Through that needle, a wire is put up. Over that wire, a catheter is put up. And through that catheter, dye is squirted so you can actually opacify the vessel and see it.
Wow, and then you watch on a monitor as you go
watch.
through, and you see
Correct.
that exact blockage. So
Exactly.
once you've reached the blockage, you can, like you said, there's a balloon that might pump it up, and can you chop it up? And
It's usually a combined procedure. You get a guide catheter in the artery, and through that guide catheter, you get a very small fine wire over which an angioplasty balloon, typically loaded with a stent, assuming it's amenable to such, is used to inflate, crack the plaque, open the stenosis, and then place the stent.
And the stent, it kind of reminds me of like a spring, that it's this open, hard.
It's a very tiny little coil that would make you think of the old Slinkies.
And that keeps the artery open
Keeps
as
the
well.
artery open.
Will they
Ideally.
ever get another heart attack?
Sometimes the stent can restenose. That's a problem. Sometimes there are other areas that at the time they actually presented were not flow limiting, and it would not have been appropriate to go after those at the time of their MI. But down the road, a year or two later, those other native stenoses could get worse over time, and they can present back.
Even if you do all the lifestyle changes and the preventive measures, you can still have them reocclude and reclose.
It can happen, yes, no question.
And around here, we were talking about how many heart attacks that we'll have in the United States. Here in our Tuscarawas County area, those statistics are the same?
That would be nationwide, yes.
So we need to do just as much work locally as everyone
As
else
anywhere
needs to
else.
do. We don't have that. And then if you think, well, I have a family history, or my dad had a heart attack, or my dad had a stroke, or something like that, would that trigger you to already get started on the preventive measures?
You would think so, Jen. Again, once somebody has a wake-up call, most people pay attention. And pay attention basically translates to, if you do smoke, stop. The worst thing you can do to a coronary artery is smoke. If you do have an LDL that's high, get on the right statin, get it down, check it twice a year. Take your aspirin, take your meds, stay on your Plavix or your platelet inhibitor that you need, and stay on the appropriate medicines.
That your doctor prescribes for you?
Yes.
Great, so always go see it. All right, anything else about heart attacks that we need to know? Something new coming down the pipe?
You got the 95% issue here. We covered the guts and glory of it right there.
All right, well,
There's always something new around the corner.
All right, let's not wait for a heart attack to take care of our heart.
That's correct. That's correct.
Fantastic. Well, thanks for being on Medical Minutes, Dr. Bill Pipoli. He is with Mercy Cardiovascular Institute. And for Medical Minutes, I'm Jennifer Clark.